All the sorrows and miseries. Many deaths are preventable if cancer is diagnosed and treated early. Cancer affects more than 9 million people and is killing 5 million others annually. In Malaysia, cancer is one of the 10 leading causes of death. 27,000 new cases are reported yearly. Cancer, a growing health and lifestyle problem, needs to be checked by society. What is cancer? It is a growth of cells that are abnormal, gradually forming a lump of tissue called a tumor. If the tumor compresses the surrounding cells and takes away food from them, then the tumor is malignant, as it invades and destroys nearby normal tissues as well as spreads to other parts of the body. Tumors can be benign. These type of tumors do not spread to other body tissues. However, benign tumors can still be serious if they develop in the brain or in other vital organs of the body. Cancer is not contagious. However, in the body, cancer cells spread from the original site of growth to other parts via the bloodstream or the lymph channels, where new cancer growth sites begin. Without treatment, cancer cells will continue to spread to vital organs, leading to fatality. The exact cause of cancer is yet to be known. However, up to 90% of cancer is associated with the environment and the individual's lifestyle. There are some common risk factors linked to cancer. 90% of lung cancer is associated with smoking. 30 to 40% of all cancers are associated with the food you eat. Cancer of the cervix is associated with sexual habits. Liver cancer is associated with hepatitis B and C and with the consumption of alcohol. Cancer of the mouth is associated with chewing betel quid or tobacco and with alcohol consumption and smoking. Some cancers are associated with occupational exposure to cancer-causing substances. The risks are many, and we have to be wary. The best way to avoid cancer is to reduce the risks associated with it. Adopt the following practices and habits. Do not smoke and avoid cigarette smoke of others. Eat a balanced diet, including a good mix of fruits and vegetables. Avoid excessive alcohol. Avoid chewing of betel quid or tobacco. Practice good oral hygiene. Maintain an ideal body weight through regular exercise. Avoid sex with multiple partners. Practice monthly breast self-examination. Get hepatitis B immunization. And get regular medical checkups for your own safety. For some, cancer cannot be avoided. Hence, early detection is highly important because cancer is curable if diagnosed and treated early. Everyone should look out for these early signs that usually signal the possibility of cancer. Look out for changes in bowel habits or rectal bleeding, lumps in the neck not previously present, unusual bleeding from the nose, deafness or ringing sound in the ear, non-healing ulcer or lump, or white and red patches in the mouth, hoarseness of voice for more than 2 weeks, persistent cough and blood stains in the sputum, persistent pain or discomfort or swelling in the abdomen. And especially for women, watch out for any vaginal bleeding between menstrual periods and after menopause. And look out for the presence of any lump in the breast. Should you notice any of these early signs, consult your doctor as soon as possible. Even though the chances of cancer are slim, it is prudent to be extra careful. Remember, cancer is curable if diagnosed and treated early. Give yourself a chance. Better to be sure than to be just a memory. For women, breast cancer is the #1 cause of cancer deaths among Malaysians. The exact cause of breast cancer is not known, but any woman aged 20 and above is at risk. Every woman in the risk group should do breast self-examination. Examine every month. The best is between the 7th and 10th day after the start of menstruation. For those who have reached menopause, examine on a fixed date of every month. If lumps are detected, be optimistic because 9 out of 10 lumps found in the breast are not cancerous. To be sure, all lumps should be given due attention. Most breast cancers are discovered by the patient themselves. Early detection allows for effective treatment, possibly without removing the breast, while increasing the chances of survival and success. Fight breast cancer with monthly breast self-examination or BSE. Make BSE a part of your lifestyle. And if you detect a lump, consult a doctor immediately. Breast cancer is curable if detected early and treated promptly. In Malaysia, lung cancer is the most common. It is the main cause of cancer fatalities. 95% of lung cancer patients die within 5 years of diagnosis because most patients waited and their diagnosis was too late. When detected, lung cancers are usually in advanced stages. Unfortunately, early detection of lung cancer is often difficult. Hence, watch out for the most common symptoms: persistent cough, shortness of breath, loss of weight, blood-stained sputum, chest pain, and hoarseness of voice. It is known that 90% of lung cancer is due to cigarette smoking as well as passive smoking. Tobacco smoke contains 4,000 different chemicals, of which at least 48 are known to cause cancer. The best preventive measure is to stop smoking. Stop now because your smoke may also affect your loved ones. If you are a non-smoker, avoid cigarette smoke and its danger. Other causes are attributed to occupational exposure to other cancer-causing agents, such as asbestos. And if your job exposes you to carcinogenic agents, use protective masks and clothing. Cancer of the cervix is the #2 cause of cancer deaths amongst women in Malaysia, and its incidence is on the increase. Every woman between 20 to 65 who are or were sexually active is in the risk group. Cancer of the cervix can be detected with a simple and painless Pap smear test. This simple and painless test is available at government health centers, family planning clinics, private hospitals, and private clinics. Every woman should have a Pap smear test every 3 years. The best time for the test is 4 to 5 days after the last day of menstruation. If there occurs abnormal bleeding in between menstruation, go for a Pap smear test immediately. Regular tests will help to detect cancer of the cervix early and increases the chances of a cure for you to survive this dreaded disease. Cancer of any part of the mouth is classified as oral cancer. This type of cancer affects all, regardless of sex, race, or nationality. The main cause of oral cancer is related to the habit of chewing betel quid or tobacco. Other causes are attributable to heavy smoking and alcohol consumption. Common symptoms are non-healing ulcers, lumps, or red and white patches in the mouth. Do self-examination. Check your cheeks, tongue, palate, the area under the tongue, and your gums. If the symptoms persist for more than 2 weeks, consult your dentist for an oral examination. Remember, oral cancer is curable if detected early. There are many other types of cancer that may affect us, and we have to be constantly vigilant for any early signs. For rectal and colon cancer, look out for changes in bowel habits and rectal bleeding. For ovarian cancer, be wary of persistent pain or discomfort or unusual abdominal swelling. If you are a carrier of hepatitis B or C, you need regular checkups to detect liver cancer early. Liver cancer is preventable if detected early. Remember, for some of us, cancer cannot be avoided. Early detection is important to give yourself a chance. Everyone should look out for these early signs. Look for the infamous 9. 1. Rectal bleeding and changes in bowel habits. 2. Lumps in the neck. 3. Unusual bleeding from the nose or ringing in the ear. 4. Non-healing mouth ulcers or lumps or white and red patches in the mouth. 5. Hoarseness of voice for more than 2 weeks. 6. Persistent pain or discomfort in the abdomen. 7. Persistent cough and blood stains in the sputum. And especially for women, number 8, watch out for any vaginal bleeding between menstrual periods or after menopause. And 9, presence of lumps in the breast. Early detection will give you a chance to rid your body of cancer. As with any disease, prevention is better than cure. Prevent cancer by not smoking and avoid inhaling cigarette smoke. Eat a balanced diet, low in fat with a good mix of vegetables and fruits. Avoid sex with multiple partners. Avoid excessive alcohol consumption. Do not chew betel quid or tobacco. Maintain an ideal body weight. Get hepatitis B immunization. And do go for regular medical checkups. And for women, practice monthly breast self-examination. Adopt a healthy lifestyle and you can avoid this dreaded disease. Avoid the risks of cancer and let us show the world that we Malaysians are all hand in hand in the fight against cancer. Show that the Malaysian society is progressive, healthy and productive. That cancer is curable if diagnosed and treated early. Give yourself a chance and don't forsake your loved ones during their time of need. Don't let cancer disrupt our progress and our success, for together we will succeed.